And it's time for Ask Your Family Physician, and we are sitting here this morning with Dr. Walker. Sorry.
Oh my gosh,
I'll
forgive you today.
Jacket.
Yes.
It's the jacket. It's
right.
the jacket.
This is the jacket today. Somebody's walking around pretending to be Dr. Walker. I don't know who it is.
All right. But we are making our rounds with us this morning, and we are talking about ways that you can actually save money on healthcare, and we're talking about WebRx. What's that about?
A website called GoodRx. Actually, so one of the things that's most expensive for consumers, healthcare consumers, just patients in other words, is that medications are quite expensive. So over 50% of people actually struggle to pay for medications. You walk into a doctor's office, and as a physician myself, I think to myself, I'm doing the right thing, prescribing the right kind of medication to solve this or that medical problem, but perhaps even half the time, they might not fill that medication. So it's really, you know, if that part doesn't work, then the system is kind of broken. We really can't be effective. One of the things that's most frustrating for people is that you really don't exactly know how much medications cost. There's not a lot of transparency about that. And sometimes your insurance package will say that they do cover something, yet they make all these kind of not loopholes, but hoops that you have to jump through. Step therapy, in other words, I might write for something, you have to fail this, and this before you can try that medication, for instance. So even though it's covered, it's really very difficult to obtain. And a lot of times you're not exactly sure how much your copay is going to be and how difficult. All this stuff happens in the background. Consumers and patients really don't know about it. Even doctors, a lot of times we don't know about it. But we get frustrated, for instance, when we prescribe something and it just doesn't happen. So GoodRx is a website. This actually started back in 2011. I spent a little bit of time talking to the CEO of this company, and born out of frustration about consumers not being able to find prices and good deals, basically, on medications. And a lot of times medications only cost pennies to make, but there's a lot of markups, a lot of hidden markups that happen between the maker of the medication. Then they go to pharmacy benefit managers that pay for it. They go to manufacturing places, warehouses, so to speak, and then the pharmacies themselves, like Walmart and Walgreens, etc. So GoodRx actually scours the planet looking for deals, and these deals actually occur usually between Walgreens, for instance. I'm using Walgreens. It could be CVS, it could be Schnucks, it could be Target, any of those pharmacies, and what are called pharmacy benefit managers. And these are groups, consortiums that pay for medications, that work for, like Health Alliance, for instance. An insurance company might enlist the help of this or that pharmacy benefit manager to negotiate prices for medications. Sometimes these pharmacy benefit managers, they'll directly work with the pharmacies, Walgreens, and they will make deals that say, we will sell this medication to you for this price. Well, they don't tell consumers that. So when you go to the pharmacy, for instance, you don't exactly know that your copay may be $25, for instance, but you can buy that generic cash pay without any insurance at all for $7. And you might be able to learn that by looking at GoodRx. It's a web app, it's a web page or an app that you can put onto your phone, and you type in it'll default to your location based on your GPS, and it'll look for pharmacies in your area that have that medication. It'll default to the generic, oftentimes, if that's available for you. It'll default to the normal dosing, but you can change the dosing depending on what dose of medication that you're on. And so you have that prescription in your hand, and you can kind of shop around and look to see which one is cheapest. And there's a lot of misconceptions about whether you can use this and insurance at the same time. And it's true that you can't use insurance and GoodRx at the same time, but you can use either or. So it's an either-or proposition, and you can look to see, in fact, if you have Medicare Part D, so federally funded plans, you're not allowed to use coupons usually, manufacturers' coupons, but so federally funded plans would include things like Medicaid, TRICARE, which is what the soldiers use, and Medicare Part D plans. You can use this. You can use GoodRx instead of that, though. You can't use manufacturers. Let's say that you wanted to buy some Nexium and you went to the store and you found a Nexium coupon and you gave that to the pharmacist. They would say, well, you have a Medicare Part D plan. We can't use this coupon. But the coupons that exist between pharmacy benefit managers and the pharmacies themselves, they will honor those. There's a little confusion about from the pharmacist's point of view. I hope there's some pharmacists watching this, actually, because honestly, sometimes they don't run it the correct way, but you can use either or. And oftentimes there's a great amount of savings with the GoodRx. You'll find things that are, in fact, they even have online pharmacies that are often much cheaper than what you might pay for when you just show up at the pharmacy.
Wow. Talk about, like, that's interesting that healthcare is kind of switching in this way where now there's apps, there's different things you can use, but there are some serious long-term benefits if you use this app the right way, it sounds like.
Well, yeah, we're seeing a trend towards people taking, well, I guess insurance companies are making this happen. People need to take more responsibility for their health care. That's what the insurance companies think. So they want people to understand what things cost a little bit more. It used to be that you would just show up to the doctor, there was no cost involved, and now there's a copay. That's a kind of a newer development in the last 10 years or so. And also about copays for medications. So I think it's valuable to be a consumer who's informed about that, because you can make decisions. In fact, you could say, well, I saw this other very similar medication, like, you know, doc, would you consider prescribing this instead of this because it's the generic equivalent, I can get it for this price. And once you're informed about it, I think you can, I don't want to say that you're stepping into the place of the doctors, and I know that some doctors will say, I don't like when my patients look stuff up on Google because there's a lot of bad information on the, I don't believe that, I think that, well, I do believe there's a lot of bad information, right. But I do love an educated patient because they oftentimes give me ideas. Now that I know who I'm working with, I know that they can understand what kind of level we're talking about. I can start talking to them about the nuances between this medication and that medication. And oftentimes, I'm in the patient room and I'm looking this up on GoodRx, and I'm saying, well, I know you don't have insurance, or I know that your insurance has a huge copay. You might consider using this GoodRx coupon. Let me print it out for you.
Wow.
Yeah.
Certainly changes that we're seeing here, and a more educated consumer is, you know, a better consumer. And again, that's called GoodRx if you want to download that to your smartphone. And we'll be right back with more of The Morning Show.